Welcome to today's lecture. Today we are going to discuss drugs used in the management of tuberculosis. As we all know that tuberculosis is one of the common conditions in Zambia. So today we are going to look at the management of tuberculosis. To begin with, tuberculosis is a bacterial disease caused by Mycobacterium tuberculosis. Occasionally, it's caused by Mycobacterium bovis and also Mycobacterium africanum. So tuberculosis is mostly caused by Mycobacterium tuberculosis. So that's the causative organism for tuberculosis. So we are discussing the management of tuberculosis. So the major cause of tuberculosis is Mycobacterium tuberculosis. Welcome to the aims of management of tuberculosis. Our aims or goal in the management of tuberculosis. So the first one is to cure the patient of TB or tuberculosis. The aim is to cure the patient of tuberculosis. So if a patient has tuberculosis, our aim is to make sure that we cure the patient of tuberculosis. Our second aim is to prevent the development of drug resistance. So in the management of tuberculosis, we need to make sure that we prevent drug resistance by educating the client to take medication on the right time every day to prevent drug resistance. The next point is to prevent death from active TB. So we need to prevent death from active TB. The other aim is to prevent TB relapse, which is the most common in TB patients. They have a tendency of not taking medication. So TB, they usually undergo TB relapse. TB comes back. The other aim is to prevent the transmission of tuberculosis to other patients. So the aims in the treatment of tuberculosis to prevent the transmission of TB to others. We are going to look at the categories of TB. Categories of TB. So category 1, we have pulmonary tuberculosis. So when you test the client as new sputum smear positive and also sputum smear negative, they are under pulmonary tuberculosis, they are under category 1. So these categories, they are going to help us in the giving of medication. So category 2 are those with extrapulmonary tuberculosis. Those with extrapulmonary tuberculosis is the tuberculosis which has spread to other organs of the body. And again, we have TB relapse. TB relapse are those who used to take medication, then TB relapse again. They are under category 2, TB relapse. Category 3, we have pediatrics. Category 3 is pediatrics. So those are the categories in the treatment of tuberculosis. So in this slide, we are going to discuss the first-line treatment, first-line drugs in tuberculosis. So the first one is rifampicin, which is given by the symbol R. We have isoniazid, which is given by the symbol H. Paraxenamide, given the symbol Z. Ethambutol is given by the symbol E. And streptomycin, which is given by the symbol Z. So in this slide, we are going to discuss the first-line treatment or first-line drugs in the treatment of tuberculosis. And also, there are other drugs we use, second-line drugs we use in the treatment of tuberculosis, such as ketamycin, amikacin. These are in the second-line treatment of tuberculosis. But today, we are going to discuss the first-line treatment of tuberculosis. So TB treatment regimes. So TB treatment regimes have first stage is the initial phase. This is designed to kill the lapid bacteria or bacilli. So we kill the growing bacilli and also the semi-dormant bacilli. That is in the initial phase in the treatment of tuberculosis. The second one is the continuous phase. That is where we kill or eliminate the multiplication or reduce the multiplication of the TB. the bacteria and also to reduce the failure and also relapse. So under categories, as we mentioned, we have category 1, which we said is extrapulmonary tuberculosis. Category 1, which we said is pulmonary tuberculosis. Category 2, we said is extrapulmonary tuberculosis and also TB relapse. Category 3, we said is pediatric tuberculosis. So under category 1, first 2 months, we give rifampicin, we give isoniazid, we give paraxenamide, and we give isamboto the first 2 months. The last 6 months, we give this drug for 8 months. The last 6 months, we give isoniazid and isamboto. Category 2 treatment includes people with severe TB or those with TB relapse or those who have extrapulmonary tuberculosis. So first 2 months we give rifampicin, isoniazid, paraxenamide, isamboto, and streptomycin for the first 2 months. Then the other month, 1 month you give rifampicin, isoniazid, paraxenamide, and also isamboto. Then the last 5 months you give isoniazid and isamboto. That's for 8 months. It adds up to 8 months. Pediatric treatment. So we have first no severe TB. You give 2 months rifampicin. You give isoniazid and also you give paraxenamide for 2 months. The last 8 months you give rifampicin and isoniazid. So in pediatric tuberculosis, we give the medication for 10 months. Severe TB in pediatrics, we give first 2 months, you give rifampicin, you give paraxenamide, you give isoniazid, and also you give streptomycin. And also you give second month, you give for 1 month, you give rifampicin, isoniazid, paraxenamide. Then the last 5 months you can give rifampicin and also isoniazid. So that's what we give in the treatment of tuberculosis. So we're going to look at individual drugs. So the first drug, as we mentioned, rifampicin, it comes as a tablet. Indication or uses is used in combination with other drugs. The mode of action of this drug, it kills the semi-dormant bacilli. So in the bacilli of tuberculosis is in the semi-dormant phase, rifampicin kills that bacilli. And it's also bactericidal in action. That's the mode of action. It's bactericidal, meaning it completely kills the bacteria. So the mode of action of rifampicin is bactericidal, it completely kills the bacteria. The side effects of rifampicin. We have anorexia, abdominal pains, hepatitis, and also reduced effectiveness of oral contraceptives. So if a client is taking oral contraceptives, you can advise them to use other contraceptives apart from oral contraceptives because it reduces the effectiveness of oral contraceptives. And also the other side effects is urine discoloration. Other people say orange urine. So the urine changes the color, it becomes orange. And also the other side effects is acute renal failure. So this drug can cause it has the side effects of acute renal failure. The other thing is thrombocytopenia. It reduces the white blood cells in the body. So a client need to do a full blood count to monitor the white blood cells in a patient's body. The dose of rifampicin, we give 10 milligrams per kg body weight. 10 milligrams per kg body weight. That's a dose for rifampicin. The other drug is isoniazid. Also comes as a tablet. Indication or uses, use it in combination with other drugs. The mode of action is bactericidal. So it kills about 90% of the total population of the bacilli during the first few days of giving the drug. So this drug is bactericidal, which means it kills the bacteria. It kills the bacteria. The side effects of isoniazid, we have peripheral neuropathy. So when it has peripheral neuropathy, hence we need to give vitamin B6 to reduce its effect. So you give vitamin B6 to reduce the effect of peripheral neuropathy. It has also some joint pains and also some convulsions. The client can experience convulsions when he's taking this drug. So those are some of the side effects of isoniazid. The dose of isoniazid is 5 milligrams per kg body weight. 5 milligrams per kg body weight. 5 milligrams per kg body weight. That's a dose for isoniazid. The other drug we mentioned is ethambutol. The drug we mentioned is ethambutol. Indication for ethambutol is used in treatment with other drugs. The mode of action, this one is bacteriostatic, which means it inhibits the growth of a bacteria. The mode of action of ethambutol is bacteriostatic. It just inhibits the growth of the bacteria. That's the mode of action of ethambutol. The side effects of ethambutol is optic neuritis. Optic neuritis, it causes inflammation of the optic nerve. Optic neuritis. So hence this drug is not recommended in children. So we don't give ethambutol in children because of the optic neuritis, causes inflammation of the optic nerve. The other side effects is skin rash and also joint pains. The dose of ethambutol is 5 milligrams per kg body weight. 5 milligrams per kg body weight. The other drug we mentioned is paraxenamide. Paraxenamide, the indication or uses, you give it in combination with other drugs. The mode of action of paraxenamide is bactericidal, which means it completely kills the bacteria, as we mentioned. The side effects of paraxenamide is joint pains. So a client will be complaining of joint pains. There's hepatitis, that's inflammation of the liver, and also there will be skin rash and also anemia. So when a client is taking paraxenamide, make sure that you do a full blood count to monitor the blood cells in the body. And also abdominal discomfort. So a client will complain of abdominal discomfort. The dose of paraxenamide is 25 milligrams per kg body weight. 25 milligrams per kg body weight. The other drug is streptomycin. Streptomycin indication is TB treatment in combination with others. The mode of action is bactericidal. Even it completely kills bacteria. Bactericidal, it completely kills bacteria. Side effect of streptomycin is auditory and vestibular nerve damage. Auditory and vestibular nerve damage. So this drug affects the auditory and the vestibular nerve. It can damage the auditory and vestibular nerves, and also renal damage and also skin rash. Dose of streptomycin is 15 milligrams per kg body weight. 15 milligrams per kg body weight. 15 milligrams per kg body weight. Thank you for listening to this video. If you have any questions, you can contact me in person. Then I'm going to assist you.